Hello everyone, we will start in a few moments. We'll just give it time for everyone to join. To all those who are joining us, we are going to start in a few moments. We're just going to give a few more minutes for those to join. Hello, Mr. Stackpole.
Hello, Romilly. How are you?
Very well, thank you.
Good to see you.
Thank you for hosting today's session.
No, thank you for organizing it.
We've already got a few questions for the
Great.
end.
Awesome.
So we'll start in 1 minute. We'll just give it time for those to join us. And today's session is being recorded for those who are attending as well. So hello everyone, welcome to today's webinar, The Hybrid Future of Medical Tourism. My name is Romilly Douglas and I will be your moderator today. I'm pleased to introduce today's speaker, Irving Stackpole. Irving is the president of Stackpole and Associates, a strategy, marketing and research firm. Irving has decades of experience in health tourism. He edited Medical Tourism Marketing, the first book on the subject, and is a co-author of the Marketing Handbook in Health Tourism. Before I hand over the mic to Irving, I have a few housekeeping items to cover about this presentation. First, the webinar is being recorded and will be made available via email to all participants after the webinar. We'd also love to hear from you during today's presentation, and we'll be answering questions at the end of the session. If you have a question for Irving, please feel free to drop a note in the questions section in the control panel on the right-hand side. If we don't get to your question during today's webinar, we'll be sure to follow up afterwards. So without any further ado, I'd like to kick things off by welcoming Irving. Thank you.
Thank you, Romilly. It's great to be here. Thank you all for taking the time in what I know are very, very busy times to spend time with me talking about the hybrid future of medical tourism and international healthcare. Thank you, Romilly, for your organization and for taking care of the administration in the background. In order to get started, what I thought I'd do is show what the agenda is. I'd like to talk about how we got here, what here is, talk about the health and medical travel markets, the health and tourism markets, talk about where we are now and what the future holds. This is an image of a book that I was very honored to participate in co-authoring with Laszlo Puszko about the health tourism markets, which includes medical, dental, wellness markets. The future is indeed integral with those markets. So the frame or the overlay for my remarks today is really the World Trade Organization's General Agreement on Trade in Services, or GATS, G-A-T-S. And if you haven't heard of these, we'll spend a little bit of time talking about them and why it's relevant to the markets for health tourism. We'll talk about old market development versus new hybrid market development. And I'll be pushing in the conversation about how to move from opportunistic models, which is the history of the medical tourism markets around the world, to sustainability. How can we create sustainable cross-border trade in health and medical services? And this involves creating or looking at some new models and some new ways of thinking about these markets. So this is the framework for the General Agreement in Trade and Services. There are 4 modes of cross-border trade, 1, 2, 3, and 4. And the old model, the one we've talked about most, and when I say the term health tourism or medical tourism, this is what we generally think of. And this is when consumers cross a border, an international border, for the express purpose of consuming medical services. And it can be as simple as an American going to Mexico for dental treatments, or a German crossing the border for a spa treatment in Poland. So these cross-border consumers are typically what we think of when we think of medical tourism, health and medical tourism. In the before times, before the pandemic, and we have to break time down into these 2 sections, the before times and the now times. In the before times, the national agendas, the reasons why countries were focused on health services, were to reduce or control costs, gain access for their citizens, create jobs or employment, and to take advantage of the import-export markets. So in this hemisphere, in the hemisphere I'm in the United States right now. In the North American market, Costa Rica wanted to attract consumers from Canada and the United States in order to create jobs in Costa Rica and to take advantage of the comparatively low cost that Costa Rica is able to offer, because their currency was less valuable compared to either Canadian or the United States. So these destinations like Costa Rica in the Asian continent, subcontinent, Thailand, or in Europe or Eastern Europe, Hungary or Croatia, they're able to leverage these currency changes. The consumer agenda has always been to access the services that they either want or need at a relatively affordable cost. And then for some consumers, their agenda was an adventure. And we'll see which ones those are and how this plays out. So in the before times, in the old models for cross-border trade in health, wellness, dental, and medical services, these were the drivers, the agenda. The before times in health and medical tourism markets, there was this relationship between complexity of services and frequency. So as you see here on the left side, there were high volume, relatively low unit value markets and low value, high unit value markets. So an example of a high volume, low unit value would be dental veneers or dental treatments or non-injectable cosmetic treatments, spa treatments, and that type of things. And then as you go up the complexity scale, the volume and unit value is inversely related. So cancer treatments and cardiac treatment were low volume, high unit value. So there's a definite relationship between the volume of services and the unit value of those services. And this has a really important impact in the current times because of the hybrid nature of the evolving medical travel cross-border trade markets. And of course, we all know what happened with regards to medical tourism. The old model relied upon one person getting in an airplane and flying from one location to another. And with the closure, the collapse, the shutdown of commercial air travel, that market was proved to be very vulnerable. It was a profound decline in commercial air traffic. There was also a limitation that showed up in the old model with regards to workforce. The workforce in the developed economies and even in the emerging markets, the healthcare workforce is a profound limitation to the ability of any provider or any destination to deliver on care in that destination, in that location. So these limitations, both commercial air traffic and workforce, really were brought forward as a result of the pandemic, as a result of the COVID-19 pandemic. This is especially true with regards to workforce. It's easy to think of how technology can help whenever workforce is constrained. Heck, a lot of us are getting used to checking our self-checkout lines at the grocery store or self-service at the petrol stations. But indeed, in healthcare and dental and wellness care, the direct one-on-one workforce is still a critical part. So we need to pay a lot of attention and in fact pay strategic attention to workforce, where it is, where the gaps are. And here's just a few examples of how the global workforce, the global healthcare workforce, is in short supply. The UN WHO has estimated that there are 18 million healthcare vacancies, healthcare jobs that will go vacant by 2030. It's easy to understand this when you think about how aging the developed economies are. Look at Japan, look at the United States and Western Europe, and you can see that the demography is aging. And with an aging population comes demand for healthcare services. Well, who is going to care for that aging population? This is a very critical global dynamic that's beginning to manifest itself in many locations around the world. Fortunately, I believe there are some adaptive strategies that can be utilized, accessed in order to address that issue. So one of the things that we've certainly seen in the cross-border trade, in the markets for cross-border trade and medical services, is the constriction of, or the contraction of the ability of places like the United States and the UK to deliver elective surgical procedures. So here's an article from The Economist well over a year ago talking about tens of millions of surgeries being postponed. Well, those postponements are still backing up, and the NHS is having double of a time working through the backlog. And indeed, in the United States, the same thing is occurring in Canada And in many of the developed economies, there are now backlogs to elective or non-urgent procedures. This is a real problem, and it's a problem that can indeed be addressed by cross-border trade. It's also a problem that's created problems in cross-border trade that we'll drill down into. So looking at the markets for health and medical tourism, the big question that we're frequently asked is, how are the markets recovering and where is the recovery occurring? Well, we talked about this model for segmenting the markets in terms of complexity and frequency, and certainly the low complexity, low unit value, high frequency markets are returning, and they're returning very quickly. Apparently, it's very important for people to look good on Zoom. And so surgical, cosmetics, hair transplant, these are the demand in these markets is returning very quickly and very aggressively. On the other side of the market distribution, market segmentation model, the high acuity, relatively low unit volume, but also very high unit value end of the market scale is also returning. These are exigent cardiac procedures, these are cancer treatments, and other complex medical care. We see these returning, they're returning very aggressively, which is creating another set of challenges that perhaps some of us on this call are already struggling with and learning how to adapt, learning how to fulfill that demand. So where are the opportunities? So the strategic options boil down to who. These are new markets, and these are individuals who either are more adventurous or who require more complex procedures, and persons who need very serious, very complex care are often less price sensitive than those who are accessing high volume, low complexity types of services. There's also the opportunity to develop new service lines or new hybrid service lines, which is what I believe will be of great interest to many people on this call. And this will require innovations in how practices are typically thought of. Health, dental, and medical practices are typically thought of. And this involves very often, most often, telehealth and technology applications, which are exploding. And then there are new marketplaces where will the services be provided? And this engenders or forces us to think about capital investment, knowledge and skills transfer, and of course, labor, workforce issues that will continue to be significant well into the next decade or two. Going back to the GATS, or the General Agreement on Trade and Services model, the first variation or hybrid model that I want to point to is this mode 1. So we saw that in mode 2 medical tourism, the individual consuming the service travels to another destination. Well, here in mode 1, the electronic packet of information travels, not the individual. So telemedicine, the transfer of images such as radiographic images, which has been going on now for decades in most of the developed economies, your x-rays aren't read where the x-ray is taken. It's read in some other destination. It's read in some other location, like India or Vietnam or Thailand, elsewhere. And that is an example of mode 1 cross-border trade in services. And the other example is mode 3, where providers from one country initiate or deliver services in another country. And we're seeing this with brands like Moorfields, brands like Cleveland Clinic, relocating their operating entities to a destination location in order to deliver the services there. And this is particularly interesting model as these brand relocations, these operational relocations, create risks not only for the providers who are relocating to the destination location, but also creates opportunities for the destination to educate, to transfer skills, to transfer technology. So there's opportunities and challenges there as well. And then also in this GATS model, which is the hybrid future, there is the individuals, the professionals, the doctors, the radiological technologists, the nurses who relocate from one location to another location in order to deliver services in that location. And this has been a community service model, a charitable model that has gone on for time immemorial, where trained professionals from one location, often an established economy like the United States, travel to a destination in order to deliver services. In fact, that's how Bumrungrad in Thailand got started. That's how hospitals in Costa Rica got started. That's how many clinics in remote locations got started, was by individuals from a developed economy traveling to a destination in order to establish or deliver care service delivery in that location. So that's another model for this cross-border trade. And these all get mixed together because there will be, in the future, machine learning and so-called artificial intelligence applications in telemedicine in this transfer of digital images and the machine learning that occurs around these. We're beginning to see this emerging now across the globe in many models of service delivery. There are providers traveling, relocating their operations from one location to another location in order for hybrid and risk-bearing operations to be developed there. And we're seeing skills and knowledge transfer through temporary assignment or secondment in another location that's occurring around the world. So the strategic opportunities, going back to this model, are the new markets, who are we going to serve? New service lines, what will we provide and do and deliver? And new source marketplaces, where or will these be provided? This calls up tactical requirements, such as the willingness or the consumers to adapt to these new environments. And even early on in the early recovery and the providers that are receiving consumers from foreign markets, we're seeing consumer behaviors change. We're seeing fear and confusion at a far higher level, which prompts the question, so how do we handle the pent-up demand of mode 2 medical tourists while at the same time adapting to the new reality? Well, the first thing I would suggest in terms of tactical requirements is that providers in destination locations that are receiving or want to receive foreign consumers, we need to show safety. We need to demonstrate and show safety. If we think about the tourism journey, consumers or travelers go from what's known, they overcome their fear, and they show some trust, and they they dive into uncertainty, and then they travel into the unknown. And this journey, this tourism journey for health tourists is particularly fraught. And during this recovery time, which may last many years, because we're not done by any stretch with the pandemic or with COVID-19 or its morphs, its mutations, we need to be attendant to this far more so than in the past. This media frenzy about contagion, the media frenzy about the difficulties in traveling is what people see. So we need to be very attentive in these immediate recovery times to those aspects of consumer behavior and consumer attitudes. So who's not afraid to travel? Well, there are certain consumer segments that are risk tolerant, and there are certain consumer segments that are not risk tolerant. If we are attentive to this, we can take advantage of and adapt to the pent-up demand in the health and medical tourism markets while not wasting our time and devoting effort to attempting to attract consumers who, because of their what they're receiving and what they're seeing and what they're hearing in the media, are not at all likely to travel for care. So who will be hesitant? What can destinations do to overcome or counterbalance? And what can providers do to overcome or counterbalance the consumer's fear? These are questions that will go to the very heart of what's sustainable. And sustainability means that the new models must be repeatable, they must be scalable, they have to be financially viable. It doesn't make any sense to attract consumers to your destination if the net income, the net proceeds, the gain from that initiative isn't in proportion to what it costs to secure that travel. The models have to deliver value for patients. They have to deliver value for both the sending or importing company and the country and the receiving country, the exporting. And then the impact on the environment, the environmental impacts of mode 2 medical travel were certainly a concern in the before times and will be a greater concern because what could be less efficient than to put one person inside of a jet and fly him or her many miles in order to consume medical services? We need to be attentive to that environmental impact as well. The strategic opportunity to go from an opportunistic model to sustainability is built on this three-legged stool: capital investment, knowledge and skills transfer, and the labor markets. And as I said before, the labor markets will continue to be the Achilles tendon, the Achilles heel of these cross-border trade markets for decades to come. The sustainability, these four modes will continue to evolve: foreign patients, brand reputation, education and research, financial rewards, recruit and retain professional staff, and we need to expand these commitments to being repeatable, scalable, financially viable, more value for the source country, and minimizing the impact on the environment. So I want to put forward two models of how this can be done for you. One is the Japanese market. Now, in the 1970s, the Japanese had a global opportunity. With the fuel crisis, Japan was producing highly reliable, very economical small vehicles. And the challenge was they had an aging population, so the workforce was shrinking. They had reduced birth rate, and there were limits to the workforce. So what was the solution? They went to where the workforce and the markets were. They went to the United States and they exported their manufacturing operations in order to take advantage of the workforce markets. And the story there, we know, was decades of not only efficient market performance, but in many respects, global domination. This little um, car on the top, if you don't recognize it, is a 1970 Honda, and the car on the bottom is a 1970 Toyota. So the solution to the Japanese problem was to go to where both the workforce and the markets were. Now, in medical travel, the markets for the old Mode 2 medical tourism, the markets were the United States, Canada, the UK. These are developed economies where the purchase power parity or the currency arbitrage worked in the favor of countries like Thailand, Costa Rica, Hungary, etc. This is not necessarily the case any longer because we have the workforce challenge associated with producing the care, actually delivering the care and the services. A newer, and this may be a fraught model at the moment, but a newer model is the Chinese model. Peking University has created the Global Health and Development Institute, and this institute looks to export not only technological innovation in healthcare, but to also export Chinese providers, to export Chinese labor to other destinations and to then use that as a leverage in these international markets. Now, China has continued to have geopolitical challenges, the shutdown, the close down of the markets because of their zero COVID policy has shown how vulnerable on a political basis or an economic basis certain cross borders are. This I'm not offering as a quintessential best in class example, but I'm offering it as a way to think outside of the Mode 2 classic model for medical tourism, where one individual travels across a border to consume services and then travels back to his or her source location. So I offer up this Chinese model because it represents modes 1, 3, and 4, not just mode 2, and different types of commitments to these cross-border markets. So take-home messages. First, the surge of pent-up demand is here. It's upon us. But the pent-up demand, please don't confuse the surge that you're seeing in demand as the new normal, because it is not. First of all, we're not done with COVID. Second of all, pent-up demand is not stable, nor is it sustainable as an ongoing source of market fluidity. Second, the uneven response in travel markets, in geopolitical markets, in different public health responses that different countries are taking toward the pandemic, this uneven response is delaying recovery. We all understand what's happening in airports, or we see it in the news. Those of us who have started to travel again completely understand what's happening in airports. It's chaos. Part of it has to do with the shrinkage that occurred in the travel sector and its difficulty because of labor markets and workforce in part, its difficulties in the travel and tourism markets to re-expand in order to receive this pent-up demand. So the coaching here is pack your patience on every dimension, every end of the trip. Some segments are more risk tolerant. Cosmetic segments, the body image management segments, the cosmetic surgery, even if you wanted to call it the self treatment, these segments are very risk tolerant. And so we can see, we can expect, and we can rely upon these segments, these subsegments, continuing to travel across borders to consume services, even hedonistic services, spa treatments, massage treatments, Ayurvedic treatments, etc. We're going to see that some segments are risk averse, but with that always we need to continue to show safety. Safety historically was never an issue that in the health, dental, and wellness domains we would address, because to raise issues of safety was to raise questions that we didn't need to or didn't want to answer. But that's no longer the case. We have to show safety frequently. And the way we do that is with standards, by showing our compliance with standards, by showing images of individuals in our centers, in our businesses, exhibiting safe practices. And standards are proxies for safety. TMOS, various cleaning standards, Joint Commission, these are proxies for safety that we can and should be sharing with our audiences, especially our direct-to-consumer audiences in the markets that we serve. The next big frontier in these cross-border markets for health, wellness, and medical services is indeed the harmonization, the cross-border harmonization of standards of practice in wellness, health, and medical services. So I commend that to you. For those of you who are on the early stages of your career, this is a big issue now, and it will become an even greater issue as we roll ahead. One of the questions is, where's your data? You know, those of you who wear Apple Watches or who store your health information in your smartphones, where's your data? This data crosses international borders. This data is being stored in a location that's a completely different legal jurisdiction from where you are. This type of thing is enough to give lawyers apoplexy, nightmares. But this is a big issue, and the post times, the new adaptive times, will create a demand for resolution in these matters. So some further take-home messages. The GATS Mode 2 exports, we've seen how these markets are highly vulnerable. The war in Ukraine has shown this. The pandemic has shown it. The fluctuations in currency, purchase power parity, has shown us that. And the other strategic takeaway is what got us here to where we're talking about a global market for health travel won't get us there. It won't get us into a vibrant, sustainable future. What will get us there is thinking about the General Agreement on Trade and Services Modes 1, 2, and 3, the exchange of health information across border, the exchange of provider provision operations across border, and the exchange of individuals across border. These dimensions should expand what has been a medical tourism market and expand it significantly, but will require new thinking on our part and a new approach to what was an opportunity. And the other, to make it sustainable, is labor and sourcing the labor, the skills and how to transfer those skills, and deploying that labor into locations where it can serve the populations. This is indeed the new hybrid model where telemedicine, telehealth will lean into machine learning and ultimately artificial intelligence applications, where multinational operators will gradually take on greater levels of risk and bear greater levels of risk in foreign markets, and where we will see individuals with skills, nurses, doctors, radiological technologists, physical scientists to data scientists to genomic scientists. We will see these individuals crossing borders and transferring skills in order to access global markets as well. So with that, I'd like to stop here and open up the conversation to some questions and see how I might be able to provide some answers.
Thank you, Irving, and thank you for the informative webinar. So yes, we have some questions, and let me start with them. So the first one is, what about telehealth as a disruptor in medical tourism? How will it impact my business?
Well, that's a terrific question. I'm unsure because I don't know the specifics. I'm unsure how to say how it'll disrupt your business, but here's some certainties I can say. First of all, telehealth will find its way into any care episode that extends either before or after the individual might be treated by a provider in another location. So if you think of a typical surgical intervention, and I'm going to use the example of a simple knee replacement, an arthroplasty, there's a diagnostic period that occurs first that the responsible provider will want to evaluate the clinical status of the individual. The clinical provider will want to evaluate the actual radiographic evidence of the deterioration of the joint. And then the provider, if surgery is indicated, the provider will want to perform the surgery, probably where he or she is. And then which means that the consumer will have to travel. And then there will be a period of rehabilitation and recovery. Well, we know with arthroplasties and fundamentally elective procedures, and there's a tremendous backlog of these in Canada, the United States, and the UK, that after the surgical procedure, there's a recovery period. Well, there's no reason, fundamentally, why the individual patient, the consumer, shouldn't be able to travel back to her source location and to be followed up by that provider with remote patient monitoring, with the same telehealth and remote patient monitoring technologies that enabled the provider to evaluate the consumer in the beginning, prior to the procedure. So if we look at this as an episode of care, we can see that telehealth, telemedicine, remote patient monitoring, these are all digitized components of care delivery, that these created like a sandwich for this episode of care. And one can easily see how these digital services will bookend many different types of procedures. There's a host of challenges associated with that, not the least of which has to do with standardization of practices, jurisdiction, all kinds of issues, but I'll leave that, perhaps somebody's going to ask about that. I'll leave that to another webinar, but that's how I see it happening.
Thank you for that. Next question is, you talked about the pandemic during the presentation, the webinar. Is the pandemic, the coronavirus, really over? Will there be more problems with travel?
Well, that's certainly a good question. I was just at a summit, a global healthcare summit in New York City yesterday, and listened to Dr. Deborah Birx talk about this, and I am convinced, as are many other people, that the pandemic is not over. We as a people, and the media and the governments, we desperately want to go back to normal, but one cannot accept a quote unquote normal situation where there are still thousands of people being infected globally, it's tens of thousands of people being infected every day, and globally thousands of deaths every day. One cannot say that the pandemic is over. And the pandemic is still wreaking havoc. For example, in the travel and tourism industries, on which mode 2 medical tourism relies, in the travel and tourism industry, in these sectors, um, the coronavirus infections, COVID infections, are removing people from the workforce on a daily basis. On a daily basis, people are getting sick and having to call in to not go to work. And that creates further disruptions in the ability of travel and tourism providers to meet the existing demand. So these, and the same thing is happening in hospitals. Nurses are calling out, physical therapists are calling out, radiological technologists doctors are calling out because they have the symptoms and they have to withdraw themselves from the workforce. So no, the coronavirus pandemic is not over. We are in a different period of, in a public health matter, of the pandemic, and a period that is deeply frustrating and still disruptive in the markets for cross-border trade and services. That we have to acknowledge its continued presence in our lives and in our businesses.
Thank you.
I hope I answered the question.
Lots to ponder on. So, next question. How can we take advantage of the delays in Canada for elective procedures?
Oh, wow. Oh, that's a very good question. So, Canada and the UK, but Canada is suffering, and I use the word suffering advisedly, a profound contraction in supply. Their hospitals are simply not able to meet anything like a baseline level of demand at this time. And there are some people on the call here from Canada. I looked at the list of people who signed up. So my empathy, sympathy. If you disagree with me, I'd love to talk with you after the webinar. But Canada is really enduring a significant contraction in their secondary, tertiary, quaternary services, their hospital services, and therefore their ability to meet the baseline demands of their population. This creates opportunities, especially for the travel corridors in which Canadians are accustomed to traveling. So Canadians have lots of what are referred to as snowbirds, lots of consumers who travel to warmer climes in Mexico, Central America, particularly Costa Rica and Panama, in the winter in order to escape cold and dark. There's an opportunity there for destinations, those destinations, and the providers in those destinations to leverage that lack of available supply, and B, the familiarity that those consumers have with those pathways. There's a real opportunity there to leverage that. And that comes down to some basic block and tackle marketing, preparing good offers that meet the objectives and goals of the consumers, and delivering those offers in ways that the consumers can access. And we've talked about that in other webinars and marketing medical tourism webinars that are available on the website. I don't want to get into too much detail here, but there's a real deep opportunity to accomplish that at this time. And similarly in Europe, there's an opportunity to meet the needs that are growing within the NHS for demand and supply. The supply exists outside of the NHS, and matching up that the frustrated consumers, not frustrated like emotionally frustrated, but the inability to access elective and delayed procedures in other destinations that are very familiar with the citizens in the UK.
Thank you. I hope that answers that question. And the next question is, do you feel inbound medical care to the US will continue to decrease since COVID?
What a good question. So inbound care to the US was profoundly impacted, as was inbound care everywhere, by the pandemic. What the United States has always enjoyed as a brand is its perception of having a healthcare system that's best in class, leading edge, scientific breakthroughs, very high universal standards. And so that was compelling and attractive to many people. To the extent that the travel and tourism sector have been damaged, the United States inbound medical tourism was also damaged, except where, as I was talking about the market segmentation model, except where you have very high acuity, very low volume care. In other words, if I'm a father of a 10-year-old boy that develops a neuroblastoma, I want the very, very best care for my son. I'm going to go to where I can get that care, if I can at all afford it, or if I can scrape together the money to do it. And the brand of the United States to provide that care is very well established in Latin America, in Mexico, in Central America, and other places in the Caribbean. So I may very well want to get to Florida. I may very well want to get to Texas or to South Florida. That is a very solid bet. That will continue unless there are issues around price and a lower cost, high quality provider can insert itself into that flow. But yes, I believe that because of the other end of the market that is going to come back, has come back, is the cosmetics. And the United States has really never offered a high volume of these low unit value cosmetics because of the price point differentials. The United States dollar, the American dollar, US dollar is so strong against other international currencies that very often, unless you're very well to do, where you can go just about anywhere you want to, that's an inhibition to that. So in the high acuity, the very complex, low unit volume, low unit, high unit value markets, the cancer treatments, the cardiac treatments, the United States will, its dominance in that market will continue, but it is at risk because of these other factors that I've mentioned. I'm sorry if that's not the answer you wanted, but that's how I'm looking at it these days.
Thanks. And we have one final question for the moment, which is, what about dental tourist markets and COVID?
So the dental tourism has really been a bright star in the cross-border trade in health services. Hungary led the charge in developing an extremely efficient export market for dental treatments. Many people from around Europe went to Hungary. Good price point, good value, very well promoted, very well organized providers there. So dental tourism led the way there. On the other side of the pond, between the United States and Mexico, there's a very robust trade. You can go just south of the border from the United States into Mexico, into towns in Mexico, where every other storefront is a dentist offering very high quality, low price dental treatments for Americans crossing the border. So yes, dental tourism is a very solid, sustainable market, in part because it's not intermediated. There's no insurance question generally. Dental treatments are paid for out of pocket, so the markets are quite price sensitive. And because there's been in Mexico and Costa Rica and in Hungary the development of very high standards of practice, it's well accepted. There's well accepted quality. One of the things that we need to deal with in these markets that I would urge any destination managers on the call to consider is the development of consumer complaint adjudication. That needs to be handled, and it needs to be handled on a more rigorous basis in most of the destinations for dental tourists.
Thanks, Irving. And we have one final question that's just popped in, and it says, have you seen or published data that's showing low acuity, high frequency treatments are surging back?
Yes, I have anecdotal information from clients that we work with, and information with regards to intermediaries that we work with, showing that that volume is coming back, at least attempts at that volume are coming back. And furthermore, we see between the United States and Mexico, there is good data about the frequency of border crossings. So we believe strongly that the anecdotal and the supporting proxy evidence is clearly showing that these volumes are coming back. They are coming back. They are not what they were. And the consumer behaviors that have changed, the consumer attitudes that have changed as the result of the pandemic and as the result of the widely broadcast chaos in the travel market, these, I believe, are acting as a constraint, a restraint on these markets, but they are solid and they are coming back.
Thank you. And that comes to the end of our questions for today. Irving, do you have anything further that you just want to end with?
Well, thank you all for being here. I know it's taking an hour out of your lives to participate in this conversation. I also know that there was quite a variety, a very eclectic group on the call. So if you have particular questions, comments, or observations, I'm very, very happy to receive them offline through email or WhatsApp or any other channel that you choose. And I look forward to seeing you again soon. Do check out our book, The Marketing Handbook for Health Tourism, and I hope to see you at a conference or at an event in the not too distant future. Thank you.
Thank you, Irving, and thank you all for attending today's webinar. We do hope you found it informative. We will be following up with a recording of today's webinar and a copy of the slides to everyone. And feel free to email Irving and I with any comments or suggestions that you have. You'll be asked to fill in a brief survey after this webinar finishes. We will learn how to improve our webinars going forward from these. So thank you very much, and thank you all for today's time. Thank you.